Hello, my name is Eric Hunter. I'm the president and CEO of CareOregon. For folks who don't know us, we serve 450,000 Oregonians on the Oregon Health Plan and with house call providers by providing community-based health care to our neighbors from the North Coast, south in Jackson County, the Portland metropolitan area, and across the state. At CareOregon, our mission is to inspire and partner to create quality and equity in individual and community health. We've been doing this for over 25 years, but the events of 2020 emphasized the need to center our work in the needs of our communities. So we've doubled down on our efforts to bring this mission to life. In the early months of the COVID-19 shutdown, we invested over $2 million in community-based organizations working to make sure that our friends and neighbors wouldn't go without food, access to housing, needed social supports, and more. We deployed staff to provide pro bono support to organizations like 211 to ensure they could handle the sudden influx in requests for information. And we invested over $30 million to help our medical, dental, mental health, and transportation providers keep their lights on as they saw a sudden decline in visits. Our staff and members were also impacted by wildfires that moved through large portions of our service areas. We stepped up to support those team members and their communities recover. These events made clear the need to truly partner with our communities in long-term efforts to address the social health needs of our members that are amplified by crisis. This is work we're excited to not only lean into, but to lead. Inspiring and partnering with the community to improve health is what we do. That is the CareOregon Effect. In 2021, we'll continue to work with our dedicated provider partners to make sure that all Oregonians have access to physical, dental, and mental health services, and that they can get those services in a way that works for them, in their native language, with cultural competency, in environments that feel safe from providers they trust. We'll also continue the partnerships that drive the healthcare system to pay for outcomes, not just services. We look forward to working alongside our provider network to make value-based care the industry standard and drive improvements in community health. Doubling down on our mission means that we're going to be more vocal about our collective fight for social justice, for our members, for our staff, for our community, for our nation. We know that this work lacks authenticity if we do not address our internal needs to support our staff doing the work to support the external needs of the community. I'm excited to announce that we've created a new position, Chief Equity, Diversity, and Inclusion Officer, to lead our internal and external efforts to address the ongoing health disparities that impact communities that have been marginalized for centuries. We know that undoing the negative impact of systemic racism is not the job of one person or one organization. But we also think that each CareOregon employee can have an impact on this work within the community, and we want to make sure that our employees have the resources, support, and leadership they need to help drive change. We're excited about 2021, and we're excited to partner with the community to make healthcare work for everyone.